Hello, everybody. Welcome to Nurse Practitioners Changing Practice. I am Dr. Carol Berger.
And I'm Dr. Nina Zimmerman. Welcome.
Today, we're going to talk a little bit about what it feels like to walk in the shoes of a provider.
Uh,
It really really is a transition. You've gone through school, you're finished with it, you scheduled your test, you're in that, when you go in there. And I don't know how it was for you, Nina, but for
yeah,
me, I was scared to death to hit the button to know whether I passed or not.
yeah, that's a good point. So I can share with all of you that I had an anxiety attack during my exam. I had tremendous test anxiety that I dealt with in NP school and was successful. But and I felt very prepared going into the exam, but in the middle of the exam, I thought, what if I don't pass? Right. I was already working in a practice. I wasn't working as an advanced practice nurse because I wasn't certified yet, but I already had a job. And so my job to continue where I was riding on this passing this test. And I literally got in the middle of that test and I could feel myself going into this state of panic. And so I stopped and I put my head down and I just, for like 5 minutes, seriously, I just had to work on my calming myself down. And then I was okay, but I know it affected the score of my exam. I just know it did. And I passed, but same here, Carol. The overwhelming thought and feeling of the responsibility was overwhelming.
Mm-hmm.
However, it was exciting because I knew with that responsibility, I had the ability to really make a difference in patients' lives differently, not necessarily better, but differently as a registered nurse. So yeah, I felt I had some overwhelming feelings at first.
Yeah, I think you're excited and scared. And for you, you had your first job. I was looking for mine. So this meant now I could interview and I could get that first job. And I remember getting that first job and then going on my first day, still feeling like a student,
Right.
still feeling like I had a preceptor, not really ready to really. I mean, I was in those shoes, but those were big shoes. I felt like I was a little kid walking around in my mother's, big high heels, clunking around, and I did not know how I was going to do this. And I had multiple providers I was working with, and all of them had different approaches. So I couldn't get the same answer sometimes from the same provider. Also, they had expectations that I was ready.
Right.
And I think we are ready, but we aren't really ready. I mean, we've had 500 hours or 700 hours under our belt. That's a lot, but it's not enough to say, okay, I really feel ready to do this on my own. So it was scary. And I really felt like an imposter walking around, signing my name to things. And I used UpToDate all the time. I mean, UpToDate was open 24/7. I always looked everything up. So it took me twice as long.
Yes.
Those were long, long days I put in, really long days.
Yes, and it was my first practice was not a good fit. They had never had a nurse practitioner, and I was, striving and trying to be autonomous, but I just really was kept down basically, and had to advocate for myself, and it got better, but it just wasn't a good fit in the office with the people that I worked with and my collaborating physician, and so definitely imposter syndrome because it was not a good environment for me. And I felt like, well, maybe I just shouldn't be a nurse practitioner because now I'm in this practice. It's not a good fit. I'm having to learn all the basic things and go through my collaborating physician more so than I should have to being autonomous, but needing
Mhm.
support and feedback, and thinking, what did I do? I was a nurse for 15 years before I became a nurse practitioner. So
And
honestly, yeah, I mean, honestly, that there's a new push for the new guidelines for nurse practitioner curriculum and clinical with in the guidelines for what we abide by for nurse practitioner programs, National Task Force, NOMF, and there's a push for increasing the clinical hours. And I have to say, as a nurse practitioner, as a nurse practitioner faculty, I'm sure students, nurses are possible people listening to this are thinking, oh no, not more hours. But I'm
but I
telling you,
really, yeah, I'd have to agree.
I agree. It's a good thing
You
to have some
need
more
more
hours.
hours. When you think of a physician, and I'm not going to say I'm an expert at their program, but I think they have somewhere around 3,000 before they actually step into residency. And I mean, 500. Now, I know they say we bring with us our nursing experience, and I value that. I love how Dr. Moore talked last week about leaning into your nursing and not forgetting your nursing, because that's what brings us there. And we do bring that experience, and we do have a jump start on knowing medical terminology and how to interact with patients and handle them. We have that already. But we have not walked in the shoes of a provider. We have not diagnosed. We have not prescribed. We have not looked at the clinical picture in the same way with the same focus. And
Right.
that takes time and experience. And we can only get so much in school. That experience is what really teaches us, being out there with our preceptors and getting that confidence and building upon that confidence. Learning how to manage multiple comorbidities. What's a real emergency? What did I miss? Just making that first mistake and maybe having a little cushion under you, somebody to catch you and say, wait a minute, that was probably the wrong choice. So I agree. More hours really, no matter, it's a good investment. It really is. And I think it will bring us closer to autonomous practice.
Right.
Which is
Missouri, where Carol and I are reside and practice is Missouri. So we still have a collaborative practice agreement that's required. I know a lot of NPs that may not have it required, but they have that in place so that they have, a designated physicians or other healthcare providers that they collaborate with. So you always collaborate no matter if you have a collaborative practice agreement or not. All
right.
Collaborate.
Everybody collaborates.
Yeah.
Even if you're autonomous, you collaborate.
Even if you're autonomous, right? But I just agree with adding more clinical hours. I know it may not be necessarily clinical patient care hours because there is a push for entry level nurse practitioners to be a doctor of nursing practice. So some of those hours may be towards their
project
and their scholarly project. However, we can't get it. I mean, we just can't get enough clinical. It's just so important.
It's really important.
Yeah, it's where everything comes together. If you're a student listening or thinking about being an NP, it's where all of the knowledge and your previous experience as a nurse, but your knowledge of diagnosing, assessment, diagnosing, clinical management, critical thinking. That's where it all comes together in the clinical setting. And so those hours are important. Make sure you're selecting preceptors that that are a good fit for you, that you get some great experience of being autonomous as much as possible. And if it's not a good fit for you, to select and try and change your preceptors, because that experience is just invaluable.
And so for me, I think once I'm into practice, for me, I was trained as an FNP, and back in the day, we could work in the hospital. So it was a different setting. It was a setting I was familiar with, very familiar with, but not in that role. Okay, so it was a big adjustment because in my training, some of the things they cover weren't necessarily some of the things that I had to learn. So I had to really be mentored along with some of the things. Just for example, antibiotics and things like that. Things like that are different than the pathways we treat are a little different when they're an acute case versus a chronic case. But very good experience, honestly, truly. It is what doctors go through for a residency is in a hospital, and they rotate before they go into clinical practice. And I don't know. I would advocate for so many hours of that kind of exposure, just because it does kind of help round you out to see what does it look like to be an exacerbation, and how do we treat that, so that when you are in the office and you get somebody who is in that state, you know what to do. And so I would say for me, it took about 1,000 hours of
Yes,
experience
absolutely. Mhm.
before I began to start settling in and saying, okay, I'm in the groove. I know where my resources are. I have a new network. Like you mentioned, we all collaborate. That doesn't end. I mean, even if we're autonomous, we're going to have a GI doctor that we can call, and a cardiac doctor, and an ortho doctor, and a nephrologist, because we're going to have people that we need to refer to them because they're needing them, and they want our business, so they're going to be nice to us, and treat us. Most of them treated me with respect.
Yes.
So you build those collaborations and you start branching out. But I'd say it was about 1,000 hours before I really started feeling like, okay, I'm there. I don't know. How did you find it?
No, I agree with you. The other thing that I found, and that I incorporate in my teaching, or when I have a student in my clinical practice, is that you need to know what you know, and you need to recognize what you don't know. And it's really important to recognize what's emergent and what isn't. And lastly, when do you need to collaborate with another healthcare provider, right? Recognize that you are not going to know everything. Recognize that you're going to take a history, assess a patient, and you have an idea of what your differentials are, but you feel like, wow, I really need to discuss this because this patient's really complex. They have a lot of comorbidities. They're not textbook telling me that they have a specific problem, and I really want to make sure I'm not missing anything, and balancing how many diagnostics I want to order, so that it's not so expensive. So for me, yes, I needed those 1,000 hours. I needed my second practice to be very supportive and encourage autonomy, and I had a great collaborating physician who just challenged me and helped me really learn, and to look things up and to come up with my own plan, but to be a sounding board. So again, you don't have to have a collaborative practice agreement for that, but I really had to spend time getting over my anxiety about the responsibility that I was taking, to feel comfortable in my role, and to really truly recognize what I know and what I don't know, and when to seek help.
And to be okay with that.
And to be okay with it.
You were not going to know everything.
No,
and
no provider is. No provider.
And that's the one thing I will always tell my students, is that medical doctors, doctors of osteopathy, even with years of experience, still miss things. They still make mistakes. They do the best they can, but we're all human. And in our humanness, somebody else might pick up something we didn't. And I always say, if you question it, if you have a question about it in your mind, in your gut, you need to ask somebody then. Right. Because don't just say, oh, that's just, it'll probably be okay. If you're questioning it, humble yourself enough to say, okay, I'm going to reach out, even if it's to another nurse practitioner, that's fine. Yes. Two heads are better than one. And then you'll either get a reassurance, or you'll get, oh, you know what, you might want to try this. And then you'll think about it and go, oh, that's a good idea. That's what medical doctors do. That's what, when they're in their residency, they call their collaborating, or their attending physician, right? And they ask them what they think. And it's only by walking in these shoes.
Right.
You walk in the shoes until the shoes fit.
And they feel good. Or they
And
feel
then
right.
they feel right. And there's this moment, I can't tell you when it happens or when it occurs, because it's different for every person. But at some point you realize that when you're sending your patient, let's say, to that specialist, or to, let's say, back to your collaborator, because you've tried everything, they send them back to you. They didn't change anything because you did do everything that they would have done. And you've learned, you've gotten to a point where you know how to work a person up correctly, and you know when to reach out, and you have your network, and those shoes now fit you, and you can walk in the shoes feeling more confident. And that doesn't mean you won't ever make a mistake,
Right.
because you can, and you may, like I said, we're all human, and people are complex.
We're practicing. We are practicing medicine. It's an art. It's an art to practice nursing. It's an art to practice medicine. And so, we're human, and the clinical decision making takes time. That's why we continue to have relationships, and our patients come back.
Now,
have them
but
coming back.
My best advice for my students, and I know you're the same way, is just keep walking in those shoes.
Yes. Good
And
point.
at my age, and I'm going to be 63 this year, so I should not be doing this. But I also have a 16-year-old son. And for those of you out there who have gotten in a car with a kid that just got his permit, and you're headed for that highway, and you're praying to the stars and the God above that they can merge successfully, right? And like I did, my son just went all the way down a really busy street, and he navigated it just well, and he probably could pass the driver's test.
Yes.
But there is no way I would send him out on 270 traffic.
Right.
He's not ready for that yet.
Not ready.
And the only thing that's going to teach him that, because we've taught him how to turn right, how to turn left, how to look, how to brake, we've talked him through different situations, but the only thing that's going to teach my son how to really drive is facing those situations, making decisions, making mistakes, correcting himself, hopefully not getting too scuffed up in the process, right? Most of us do. And then we, somewhere along the line, after we've driven so many months and so many places, start feeling comfortable.
Yeah.
And so that's my parting thought, is you got to keep walking.
And the other thing that I think is important to think about or talk about briefly is, how did you feel when you had a negative outcome, like a known negative outcome with your patient? How did that feel the first time? So I know students who are listening, or new NPs who are listening, or nurses who are thinking about being NPs, how does that feel? I mean, what did you do?
I can remember my first encounter when something really went wrong. I had done everything. It wasn't fair. For me, luckily, it happened very quickly. Because I think if it happens really quickly, you become more careful than if it takes a long time for that moment to occur. But I had followed the advice of my provider, and I had done what the provider had suggested we ordered, but the outcome with that particular thing didn't turn out the right way.
Yeah.
And things spiraled from that decision out of control. And this person, who was already elderly and who was already very, very sick, ended up going through a lot that they maybe they would have, maybe they wouldn't. You don't know, because you're already talking about somebody who's very sick and who's facing a very serious illness at an elderly age. So, but oh my gosh, I cried.
Yeah. I
wanted to quit.
Yeah.
I didn't want to touch anybody ever again, because I thought, oh my gosh, it hit me like a lead brick I guess, that,
Lead
oh my
balloon, yeah.
gosh, I wrote something and it could have caused all of these events to have happened. Maybe it didn't, but maybe it did.
Right.
And I think that I was lucky and fortunate enough that that physician sat me down and said, given what you knew at the time and how much, we did the right thing knowing what we know.
Yep.
Um,
Yep.
and that's all anybody can ask you to do.
That's
Hindsight is foresight. We
20
can
is
always
foresight,
look
yes.
back.
Yeah, I had a similar situation. It was a negative outcome, and I had talked to my, again, my collaborating physician about the situation, and he agreed with the plan. And it was a bad outcome with this patient that neither one of us anticipated. And I was very, very upset about the outcome and what happened. And he said the same thing. He said, "Look, there's nothing that we didn't have any indication of this, of what would happen with this. We did what we thought was right. Unfortunately, the patient the patient took a whole bottle of the pills that I prescribed, and died. But it's not what I prescribed. I prescribed
Right.
one.
Right. You said take it this way.
Right. And I had assessed for depression, and I mean, all those things happened that there was no indication that was a problem. It was a muscle relaxer. So,
Yeah.
But the bad outcome really hit me hard. And
I think we take it to a different level. And as nurses, and we just think about as a nurse, how do you feel as a nurse?
Right.
When you miss something with your patient, and you can relate to that, because as a nurse, I can guarantee most of us have given the wrong medicine at one time or another, or the wrong dosage, or the wrong route, or we missed something. We missed a lab.
Yep.
Hindsight is foresight. I mean, we can always look back and count how, what steps we could have taken differently, how we could have assessed differently. We're looking at complex people sometimes who have complex things going on, and
things you can't control either.
Yeah, maybe you're looking down the right path, and it's the left path that you should have been looking down, but the right path distracted you. And you focused on the wrong thing. And it's something you're going to have to learn how to deal with, but you've already done that. Yes. As nurses, you haven't most of the time done every single thing right. You've made a mistake, and most of the time we don't have horrible outcomes. This time we are in a little bit more of a tenuous situation. Mm-hmm. And we just hope that, that's one thing I always say, it's usually there's not just two eyes on a patient.
Yes.
There's your two eyes. There's pharmacists who've caught my mistakes.
Yes, absolutely.
I thought I prescribed this and it looked just like that, in Epic, it comes up as hydroxine instead of hydralazine. I mean, they're right next to each other.
Right.
And I had a good working relationship with my pharmacist. He said, "I don't think you prescribed this one for itching," and I'm like, "Oh my gosh," so you're not alone. Usually there's more eyes than just two. So hopefully, somebody will catch your mistake and you'll catch somebody else's. And we need to be kind to each other.
And to yourself. Mm-hmm. When things happen, as a nurse and a nurse practitioner, the best advice I can say is, be kind to yourself and really look at what happened, learn from it, and also understand that we all are doing the best that we can. And we're human. This is not to scare anybody listening to this. It's just the reality of it to help prepare you that things will happen. Not every patient situation is going to be perfect, go the way you want, and things are going to happen. And so you have to prepare for that. Trust your nursing intuition.
Yeah, right? You got to learn how to trust your gut.
You got to trust your gut and seek advice, seek consultation in any role that you are, and trust your gut that something doesn't feel right, and do your best. And remember too that I've had a patient situation where I knew that it was a serious situation, and
They
gave
didn't follow
advice to
your
the
advice.
patient.
Yeah.
Yeah, I told the patient, we need to call 911. I'll call right now. No, I don't want to. I'm going to wait for a couple hours, and there was a bad outcome. So, you can only do so much.
But now on the
Yeah.
flip side,
Yes.
on the
What's
flip
positive?
side, so we end on a positive note too. There is no feeling like finding something and
Yes.
fixing something, or in some cases, saving somebody's life. And
Absolutely, it's gonna happen so
that's
much
going to
more in
happen too,
practice.
you know.
Yeah.
And I'm not going to say I can ever feel like I take credit for saving that person's life, because that doesn't feel right either.
Yeah.
I would say that more times I would say I had that gut feeling I needed to check something.
Right.
And that same intuition that can, tell you, oh, be wary of this, you need to learn to listen to. And if you feel like you need something, then you need to trust it. And sometimes you're going to find out you caught somebody's cancer at a very early stage, or, you did the right thing that just turned it around. And there's no feeling like that either.
Right. You really, to me, it all starts with a good history and listening to your patient, right? We are all rushed because we have limited time with patients, but listen to what your patient is telling you. It's very important. Very important. Your history taking and
They'll
your
tell you
assessment
what's
skills,
wrong.
they'll tell you what's wrong.
They'll tell you what's wrong. If you
They will
listen,
tell you. If you're listening, you know, if you're listening, you'll catch it. But I just think that that's the core for me, is really that patient relationship, and listening to my patient, and it's
and
just so
building that
vital.
relationship. As a nurse, you can take it so far, but as a
Right.
provider,
Oh wow, it's so
there's
awesome.
there's no comparison to the developing relationship, the trust, how much you care about them. They become family to you. You want good outcomes for them. Your heart breaks if it's a bad diagnosis, and your heart soars if they beat it. You're going to travel this road with your patients, and there's no road I would rather be on.
It's just the most awesome profession and awesome feeling in the world to help patients in some way, shape, or form and have those relationships. It's the best part to me about being a nurse practitioner. It really is.
Yes, I have no regrets. I would have done
I
it
don't
sooner,
either.
and no
We have
matter.
the best profession in the world. We really do.
And we're the
so
most trusted.
Yeah.
We're the most trusted profession in the world, or at least in the US for sure.
Yeah.
We are. And as providers, we are very well received. It is all of those qualities that we brought to nursing, just like Dr. Moore said, lean into your nursing, be who you are, know it's scary, but keep walking until those shoes fit.
Right.
And I'm going to leave you with that. Do you have anything else you want to add, Dr. Zimmerman?
No, I think we ended on a positive note. And for those listening, if you're considering this, it's an amazing profession, an amazing journey. Never stop learning, never stop learning, never stop caring.
No, and we welcome you with open arms into this profession.
And happy Nurses Day.
Yeah.
Happy Nurses Day.
It is Happy Nurses Day. So go out and celebrate. And from this time to next time, we will see you as we talk about more nurses who are changing practice. Bye.
Bye.